I'm going to ask you a question for the moment. For women who are in a monogamous relationship, so, and never had the situation of the situation they've got in a monogamous relationship, what's the prevalence of HPV infection? 30%, 70%, or 90%? If you think it's 30%, put up your hands. If you think it's 70%, put up your hands. And 90%? It's nearer 90. It's nearer 90. Peter, what's the situation here in terms of, we went through it a little bit earlier with Mary, but the situation is there are large groups of the Australian population who are unscreened, yet when you look at the overall rates of screening in Australia, they seem pretty good. What's the mismatch here?
The overall screening rates in Australia are generally good, but they are still below what we would regard as optimal. We would like screening rates on a regular basis, 2 to 3 yearly smears, well over 80%. We're not reaching that yet.
But some women are being overscreened.
Some women are. There are a lot more smears being done, but smears perhaps being done at inappropriate intervals rather than, how can I say, some of the at-risk women missing these smears. So when you look at the total number of smears, that should cover our population, but perhaps we're over-screening or doing too many smears in some women and others are missing out. So,
Kath, this is a postcode problem, isn't it?
We know from Mary's talk that there are particular groups who are less likely to have been to have had Pap smears. Those from socially and culturally diverse groups, those lower socioeconomic status. If somebody's got a job that they are going to have to not get pay for the afternoon to go and have their smear, and the cost that there may be if their GP doesn't bulk bill, the issues for that. Women who are disabled in any way, that may be mental disability or physical disability, and groups such as lesbian women that we often don't think about.
Diane, how do you approach this problem of the gap in your practice?
Screening opportunistically. If you meet a woman who's new to the practice, to always ask her if she's had a Pap smear, and if not, either do it at that consultation, or if there's not time, get her to come back fairly soon to screen. I guess educating women from an early age that they need to have a Pap smear. Girls on the pill, I guess, present a good opportunity. Women who aren't on the pill, you don't see them so often, so it's harder.
Claire, what was your approach to cervical cancer screening before you were diagnosed?
Coming from the UK, I started having smears from the age of 18 and would have them every 2 to 3 years. So I had one before I came out and it was negative. And then I was due for one and I put it off for a holiday. But when I was away on the holiday, that's when I had the bleeding and I thought something was wrong. So I came in, that's when they found it.
And did you have a catch-up vaccine?
No.
Right, so you hadn't been HPV vaccinated?
No.
So these are issues that we all need to confront about meeting that gap in cervical cancer screening. Diane,